Hello. Sit down, please. What is your name? And Sony. Here is your card. Yes, so good. It is your first visit, yes? I see. Okay, let us talk about what has brought you to me. Okay. You have problems with sleep. So the quality of your sleep doesn't satisfy you. Am I right? I see. Okay. Let us understand then who it happens. Okay? Now I will ask you questions, and you please try to answer honestly, and will answer more than the better, right? Okay. How many hours do you sleep? 6, 7 hours. It's usually, yes? Okay, when you wake up, how do you usually feel yourself? Different. Please, can you tell me in more details? What is the most often? You feel that you have relaxed and feel fresh. Most often you feel tired, yes? Drives. I see. When do you usually go to bed? 8 hours a night, approximately. And you wake up at 7 o'clock, yes? Do you go to bed at the same time? It can be different, yes? And you wake up at 7 o'clock. This is what you have to do. Or maybe you need more time to have a good sleep. For example, go to bed earlier. No? So you wake up at 7 o'clock and you own. Yes? You aren't able to sleep more, but general feeling is not good. Usually, yes? I see. How long you have noticed such condition? Genuinely long ago. Have you taken any actions on your own? Actions. It doesn't help, yes? So. Answer please such questions when you go to bed. How long it takes for your sleep? At least approximately 30 minutes or even hour. It is different, yes. Different sets. Don't let you, or you just lay looking at the cell and couldn't sleep. Usually such disturb you. Do you have dreams? And what typically? Dreams, what kind? Different, good and bad, yes? Okay. Has it happened that you wake up with hurt, palpitations, cold sweat? Did not notice that. All right. Look, you went to bed, fell asleep, and sleep soundly until morning, or usually wake up several times at night. Is it often happens that you wake up? So here you wake up in the middle of the night, and usually you feel that you want something. It is hard to answer this question. Think, please. Maybe it is hard for you to breathe, or you need to go to toilet, or you want to eat. It happens that people wake up in the middle of the night. It cramps your legs, for example. You haven't noticed. I see. So it is possible to say that wake up without any reason. Everything happens. It can be the reason is obvious. Sounds such you have good sensitive sleep. I see. Please tell me, do you live with your family? Good. Has someone of your family members noted that you snore or grind your teeth at night? No. Okay. Well, in general, the picture gradually emerges, but not completely clear yet. We will need to make a blood test. I'll write what kind of, and I suggest you to be examined on our clinic. The survey is you will need to spend in our clinic overnight and under control diagnostic equipment, video surveillance and mic control to have a clearer understand what exactly are related to spilling of your night. Such survey will give me us exact understand of what happens of you during sleep, and then I will be able prescribe you correct cure. Yes. Are you ready? Okay, so good. 1 second. It can be the day after tomorrow, where I have rear-ended one patient on the other time. Good? Okay, then I write you down. Okay. To get a good understanding of survey, please avoid caffeine during these 2 days, okay? Good. It will be better if you will be awake during next 24 hours. Yes, it is better not to sleep at all. Okay? Please wash your hair and don't use hairspray and gel. Okay? Also, you need to organize independently a trip to the procedure and back to home. Okay? Alright. Well then, that is all, and I'll say you goodbye to the next meeting. Okay? Good evening. I see you have changed your clothes. Oh, good. Please don't worry, it is warm hair, very comfortable sleeping place. Not bad sound insulation. Make yourself at home, please. Okay. Last night you slept? No. Oh, it is so good. Okay. The device on which the survey is conducted is called polysomnogram. It was designed specifically for you for our clinic. The device includes elements of the EJ, EMJ, ECJ, electrocardiogram. It detects airflow near your nose and arm mount. Also, I will be able to see breathing force of breasts and abdominal walls, fluctuations of oxygen in blood. Yes, we will collect a huge amount of information about you that night. Yes. Also, the unit produces video monitoring. Engine recording carried out with help of 3 cameras for many hours. At a time, machines records brain activity, ECG, arm and legs movements, lack of oxygen. It is all resulted in one, and we give a more accurate diagnosis and then prescribe treatment. Yes, let's understand what I say. A little. Alright. Okay, let us then proceed to maiden electrodes. It is a lot, but do not worry, okay? Okay, now with the help of measuring tape, I will measure the circumference of your head to determine the correct size of EJ caps. Okay? Okay. This is a cup. In such cup, 6 buttons are inbuilt for electrodes. Of course, electrodes are totally harmful and won't cause you any harm. Okay, let's put on your head cap. Okay, it's ready. It's comfortable. Good. Cup is made from elastic material. It provides good fit of electrodes to your head and head exchange. Generally, it is enough comfortable to sleep in it, especially if you did not sleep last night. Okay? Now I mount electrodes to your cup. This is electrodes, and I will put your cup on. This is electrodes. You ready? Okay. It's 6. 1, 2, 3, 4, 6. Everything is proportioned. And now with the help of syringe, I fill electrodes with medical gel. Okay. Okay. Electrodes. In principle, until the end of the procedure, it showed enough. So, all is well. And then, in the most common disposable EMJ electrodes. And one I attach to the abdomen for tracking abdominal breath. Okay. And next, to the breast zone to control your breathing. Okay. Okay. Good. Also, I attach 3 electrodes to the hair zone. Okay. Electrodes. This is pericardial zone. 1. 2. So good. Under your nose, I will attach such a tube that I will capture the flow of breath. I fastened it with plaster. Okay. This is small plaster. And I will so good. And next. We need to mount 4 detectors of your face, two for electrocardiogram sensors. The first sensor we fasten 1 centimeter below the left corner of the eye. And then and second to the right, 1 centimeter above the right corner of the eye. Okay, there. And 2 microgram sensors on your chin. There. On your chin and 1 on the lower part of your chin. Okay. All right. We need to mount 2 electrodes on your feet for registration of motor activity, and I think I fixed them with bandages just in case. Okay. Perfect. Next, it's like perfect. Okay. And on the index finger of the right hand, we need to attach a pulse oximeter. Okay, give me a finger, please. Perfect. Okay, thank you. It means to adjust snoring detector. It is little microphone we attach on your neck. Okay. So good. Check everything. Oh yes, of course, you can safely Spain virus are long enough, nothing bad will happen. During the procedure you will be recorded by the video cameras, and so I will be watching you during the night. And from the next room, I'll follow you sleeping to evaluate your condition. Of course, light will be turned off. If something will disturb you, you can press that red button beside your bed, and I will come to help you. If you suddenly need to disconnect all, we will disconnect and reattach to this issue soon. Don't worry. Okay, the light is swatches, so beside your bedside that is very convenient. You can leave a night light. Okay, you brought something to read before bed? Alright. What more I wanted to say? When suddenly some distance detector will be away with the sensor, then I come running back to attach it. Please do not be scared. Okay. Well, then let's see if everything is work properly. Now I'll ask you to breathe deep, okay? A little. Oh yes, it is good. So, everything good? And everything works? How do you feel yourself? A little bit uncomfortable. For sure. The quality of your sleep will be worse than it is usually. And now please and you will feel virus from time to time, but in the long run everything will be good. Okay, let us then slowly go to bed, and with that I leave you. Okay, thank you so much.